So let's talk about using your brain. So this is an acronym which basically stands for, it's basically a way of advocating for yourself when you're in labour, and obviously you can teach this to your students. And this is where we have our benefits, we weigh up our benefits, risks, is there any alternatives, using your own intuition, and what if we do nothing. So I'm going to explain them a bit more now. So obviously, if something happens throughout labour, we have to be able to advocate for ourselves. So first of all, we would look at the benefits. So if it is that the medical team are recommending something to us, we want to look at what are the benefits of doing that. The second one is risks. So we also need to ask them although they tend to focus on the benefits, because obviously a lot of the time it might make life slightly easier for them, we need to ask them what is the risks. So they need to be honest with you and allow you to make your own decisions by explaining the risks to you. We then have alternatives. So alternatives is where we need to be given the option of what other alternatives is there, because they might be offering you, let's say, a certain pain relief drug, but it might be that there's another one that you might think it suits you better, or you've read up on it and the side effects are less risky, or whatever it is. You need to ask about the alternatives, because 9 times out of 10 they wouldn't explain the millions of different medical options that there is to you. They'll just tell you probably what they advise you to do, and you just need to know, is there alternatives to the course of care that they are offering you. So the next one is trusting your intuition. So this is obviously a huge one, because you are mum, you are the birthing person. You need to know that you are trusting and relying on your own intuition of what it is that feels like the right thing to do for you right this minute. Now that can change throughout the course of labour if it is that it's running for a long time. That is your choice to trust your gut and think, you know what, this minute it doesn't feel like the right thing to do. I'm going to wait and see if that feeling changes. That is using your intuition, and that is your right as a birthing person. And the last one stands for nothing. So this is if you need to ask the question of, what if I choose to do nothing? So if you feel like this is not for you, you need to know what it is that would happen or could potentially happen if you choose to do nothing. So I'll repeat this all again. So we've got our benefits. What's the benefit of what it is that they're offering or want you to do? What are the risks? Is there any alternatives? Trusting your own intuition to sit with it a little while to see, does this make sense? Does this feel like the right thing to do? And what if we do nothing? Now, after you've asked all these questions, it might be that you decide to progress with the course of plan that they want for you, or you make your own decision on the matter. But these are the factors that you're going to need to know to be able to make that decision.